Today's topic is going to be hemophilia. So hemophilia is one of the most common bleeding disorder, and it is because of X-linked recessive gene, which causes hemophilia. So hemophilia is divided into A, B, and C. So hemophilia A is actually because of deficiency of factor 8. So we have clotting factors. So among them, the deficiency of factor 8 causes hemophilia A, deficiency of factor 9 will cause hemophilia B, and factor 11 will cause hemophilia C. So, and then normally when you take factor 9, 8, normal amount is 30 to 40% is present in the body, and normal range of factor 9 is 25 to 30%. So reduction in this normal amounts from this normal amounts will cause hemophilia A or B or C. So what are the clinical features? So clotting factors usually help in clotting of the blood, so they reduce the increased bleeding and then hemorrhage. So deficiency of these factors will lead to easy bruising. Easy bruising, why? Because the blood is not going to be stopped, and therefore it will lead to easy bruising. Like even small bruises can cause rupture of the arteries, which is usually uh, clotted, which is usually stopped by these clotting factors. But because of deficiency, this won't be stopped. Intramuscular hematomas can be found. Hemarthrosis. So arthrosis is joints. So collection of blood in the joints is known as hemarthrosis. So the first joint is the which is most common joint is the ankle joint, and then later it will go to the knee joint. So slowly collection of blood takes place in almost all the joints. And in cases of mild hemophilia, bleeding is controllable. Another type of, the classification of hemophilia is mild, moderate, and severe. So in mild cases, the activity of the factor is less than 5%. That is, like, it is greater than 5%. At least 5% of the factor is working. When it is moderate, only 1 to 5% of the factor is working. In cases of severe hemophilia, less than 1% of factor is only activated. Only that is acting. So as I already said, the normal levels of each factor is here. So in mild cases, more than 5% is present. In moderate, only 1 to 5% is present. In severe, less than 1% is present. The diagnosis, how do we diagnose this is by assay, a specific assay of factor 8, 9, and 11. So the treatment of mild hemophilia, we can treat mild hemophilia with intranasal desmopressin. So this is given in treatment of hemophilia, mild hemophilia, which is controllable. In the cases of management of moderate and severe, you have to do replacement therapy from time to time with factor rich blood, and then factor replacement or replacement therapy is the same, and then physiotherapy is done to prevent the chronic joint disease, that is like hemarthrosis and all. It can be prevented with physiotherapy, and then counseling should be done, because the patient has to be very careful in the cases of moderate and severe cases, and therefore counseling is a very important management.